Welcome to Wellbeing Wednesdays with Harvinder Narula on BW Wellbeing World. My guest today is Samara Mahindra, who is the founder and CEO of Carer, an integrative oncology startup that provides personalized cancer care to patients. Carer provides therapy and treatment to help patients heal better, feel better, and live better during and after cancer care treatment. Let us speak to Samara about her new book that she has written about the food and recipes for cancer patients. Hi, Samara. Welcome to BW Wellbeing World. First of all, congratulations on your new book, Thriving Through Treatment. I think it is a brilliant read. I've gone through this book. So thank you for taking out to speak with us.
Harvinder, it's always a pleasure to speak with you. So thank you so much for having me.
So, Samara, my first question to you would be, why did you think about writing this book? Why did you think that there was a need for this kind of a book for the patients?
I think that's a great question, and it's a loaded question as well, because when you're in the field of oncology and cancer, unfortunately there are so many misconceptions, right? We treat thousands of patients, and they come with us with significant amounts of discomfort. The one that is always reigning in front is, what do we eat? The nutritional deficiencies that cancer patients go through is pretty severe and vast in certain circumstances. And most of the times there would be some kind of nutritional deficiency the patient experiences. So it really inhibits them from consuming the right food, consuming the right quantities, having the right concoction or combination of foods that can really help them thrive through the treatment. For us, we believe food is like medicine. It's the foundation of your immune system. And as I encountered more and more patients, we started, giving really personalized nutritional interventions. And that's when we realized that we would see massive impact on their clinical outcomes as well. Patients would respond better to treatment. They would feel better mentally, and then of course physically as well. And there were certain recipes that, we kept finding ourselves, sharing with these patients. And we really felt that it's sinful to not share this with the world. One thing we wanted to ensure is that when it comes to cancer diets, it is not boring, bland, or extreme by any means. It can be nutritious, it can be easy to make at home. So it's very easy for caregivers to actually go and make this food for their loved ones at home. They can consume it themselves. And it's something that patients can enjoy actually eating throughout their treatment or course of treatment. So after a lot of scientific evidence, after a lot of sharing of these recipes with thousands of patients and really seeing the clinical outcomes and how they were really improving, physically, mentally as well, that's when we decided that this has to be shared with the world.
And Samara, if you allow me to ask you this question, that what are some of the experiences that you have gone through during your journey of spending time with cancer patients, survivors, etc., that qualifies you to write this book for them?
Another great question. Question I ask myself every day. I can't give credit to myself only. This book is, as we spoke before, even the interview, it's a labor of love. It's a labor of love of my entire team. So while I might be the forefront of it, and I have some knowledge of nutrition to some degree, it's definitely a combination of multiple people. We have very highly skilled clinical nutritionists who have dedicated over 10 years of their practice only in oncology, who have contributed to this book. We have had cancer experts, oncologists. There's a foreword by Dr. Ashok Ved, which you would have read about. And then, of course, myself, where we put these recipes together. So I can't take all credit. But in terms of, my journey began with a personal encounter. That is something I think now everybody knows. And since then, I saw the power of food. I saw it with my mother, 6 years while she battled cancer, while she went through, I don't know, maybe 30, 40 rounds of chemotherapy over those many years. And when I saw her diet change and her nutrition change, I saw how she responded to treatment. I saw how I could almost predict how her side effects would be after a round of chemotherapy, just with the food she was consuming for the last couple of weeks, So since then, this seed had been planted. We had to really ensure that what we are sharing with the world is something that is scientifically backed as well. Unfortunately, in India, there's a lot of there's no strong regulations, right? I come across a lot of people who, lose 10 to 15 or 20 kilos, and then they suddenly decide to become dietitians. And while I know the intention is good, when it comes to clinical situations and medical conditions, you need clinically trained nutritionists as well. So while I have done immense amount of research and study and accredited myself in nutrition, I'm still not clinically trained. And hence, I needed to be accompanied by the medical team to actually put these recipes together. So that's how we actually created the whole book.
And Samara, I see that your book has got different sections. And and these are typically the symptoms that people face. So what are some of the most common symptoms that you have observed as a cancer care therapist among those who have gone through the treatment for cancer?
So with cancer is a very complex disease, and there are multiple types of cancers, and everyone's biological makeup is very different. So it's very difficult to judge exactly what the side effect or symptom of a patient would be. But we noticed about 10 to 12 that are the common ones that majority of patients will experience, and those are the ones that we enlisted in the book. We wanted to make it very, very friendly to the person reading it and actually, cooking the recipes and the dishes. So we broke it down into various different side effects. So one would be nausea, second would be vomiting, a drop in blood counts, gut, your digestive issues like constipation and diarrhea, liquid diet. A very big concern. A lot of patients need to have semi-solid and liquid diets, and they have absolutely no idea what to consume. So we broke that down for them as well. Weight gain or weight loss. A lot of breast cancer patients, unfortunately, post-treatment, who are on, say, hormonal therapy for a long period of time, there's a lot of weight gain that they experience. There's a lot of water retention that they experience. And so we made that, a subsection of the book as well. So a patient can literally go through, or a caregiver can go through the book, have a look at what are the symptoms and side effects for that day, essentially. And then, we have tailor-made recipes specifically for those side effects.
And Samara, apart from responding to the symptoms that the patient may be facing, what is the overall role of food and nutrition for somebody to recover faster post receiving a cancer treatment?
Right. And when I think when you say post, I'm also going to refer to those who are on treatment. So post a cancer diagnosis and those who are on treatment, and then post-treatment as well, because the kind of nutrition you would consume during a treatment would be very different to what you would consume post-treatment. And then actually there would be, the type of nutrition you would consume even during the treatment would change dramatically, because unfortunately treatment has a lot of nutritional deficiencies and these keep fluctuating throughout your course of treatment. So when we work with patients, we ensure that the nutrition is tailored to where they are on their treatment protocol. So in terms of, post-treatment and while on treatment, the kind of nutrition that patients should consume is not, so the perception is that, we need to eradicate certain foods. We have to keep it really extreme. There are patients who come to us with, we want to be on a ketogenic diet, or we want to be on this alkaline diet. While there is science behind certain types of foods and diet, we have to ensure that this is tailor-made to the person themselves in terms of their background, their comorbidities, their lifestyle, the type of treatment they're on, the actual drug or molecule they are on, and then ensure that the food that we are recommending doesn't have a counteractive effect with that drug or molecule. So the nutrition during treatment is very tailor-made, it's very personalized. It's difficult to kind of point out that this is the type of nutrition that one should eat because it has to be personalized. Post-treatment is when you're looking at rebuilding the immune system. That's when you're kind of flushing out the toxins. That's when you can really go all out to start focusing on gut rehabilitation. But one thing I do want to mention to you, and I'm happy you asked this question. People do believe that, and that nutrition will cure cancer, and that's not something that we condone. While nutrition is a powerful source, while nutrition is an underlying foundation to build the immune system and build your response to treatment or treating or basically responding better to the treatment, the perception that, okay, if I consume this kind of food or this type of ingredient or this fruit or whatever it might be or concoction will cure my cancer, something that we need to kind of move forward from. Cancer is not that simple that you consume one type of food and then you're cured from it. Like I mentioned earlier, it's a very complex disease. So we need to understand that nutrition is wholesome for us, that can have an indirect impact on our healing and thriving from cancer, and not necessarily curing the cancer.
But are there any kinds of foods that you have come across while you were studying this that you have identified which say that the chances of preventing cancer are higher if you were to consume certain foods?
Of course, there are certain foods that exacerbate your risk of cancer. I think that's very well listed out by the WHO. Of course, no one wants to things like cured meat. So unfortunately, things like sausages and hot dogs and you have the cured salami and ham and things like that is something that you would try to minimize or stay away from. Excessive consumption of alcohol. I mean, I think everyone knows this. Excessive consumption of refined sugar. While there is no direct correlation or significant amount of studies identifying this, we all know that refined white sugar really is not the best for us. Hydrogenated oils, saturated fat. So there are certain foods that will exacerbate your risk, and that is because it's going to create havoc in the body. It's going to create hormonal kind of imbalances, which is what we're seeing a lot with urban women today. And that's why breast cancer risk. So one of the reasons why breast cancer risks have gone up, it creates high levels of fat, which is now a direct link to multiple cancers. And so you want to ensure that your fat levels are not very high. So again, I can't say this food will cause cancer. I can say that for cigarettes, for sure. But definitely, it has an indirect risk of increasing your chances of cancer.
And I would assume that these are also the foods to be avoided as a part of your therapy, or the food and nutrition as a part of their intake post-cancer treatment or during cancer treatment. Am I correct?
Yes, of course. So, we try to stay away from red meats. We try to, and then what we do in the book, which is wonderful, is that we give substitutes, Harvinder. So it's not about take this out of your diet and live this life, which is, we're going to kind of make it very unenjoyable and boring for you. But here are some substitutes. We have an entire section on desserts, where you can still enjoy any type of dessert, but these are the substitutes to use. So even when we eradicate certain types of foods, there are substitutes that can, be good enough to consume.
Got it. But are there some kind of superfoods that you have identified which work wonders for cancer patients or cancer survivors?
There are. See, like our Indian diet, right? Our herbs and spices are wonderful. They are all superfoods. This whole idea of curcumin has blown out of proportion, but it is somewhat like a superfood. The only thing is that the combination of this has to be understood. So, combining curcumin with a little bit of black pepper and a fat, it really increases the absorbability, I think, by 20%. So, there are certain superfoods. I believe that it's listed in the book as well. But again, if you consume a large quantity of vegetables, maybe a serving of fruit a day, high quality protein. This is, we scream on top of the mountain, always talking about high quality protein. So if you're non-vegetarian, you have to ensure that at least your white meats are coming from really high quality sources, organic. So we don't even say that you have to go 100% organic, but there are certain foods we will encourage you to ensure that is organic. Eggs are fabulous foods. Actually, egg is a superfood. It's a complete protein. It's a superfood to consume. It's wonderful for patients. It's as long as you get it from the right source. So high quality protein. If it's vegetarians, then again it's a combination of foods that will create an entire protein, and then good high quality fat. And a small proportion of that, but getting your fat from nuts and seeds and avocados and things like that can be really nutritious for the for a patient. So it's really, we don't have to get too caught up on I must have this superfood in my diet. It's a combination of good quality food, of carbohydrates, protein, and fat. Your carbohydrates essentially should come from your vegetables as much as possible. And if you're going for the grains, then stick to the regional grains and stay away from wheat, is what we would recommend for cancer patients who are on treatment. At least minimize it as much as possible.
And Samara, I was going through your book, and you have a section, a small section on do's and don'ts for people who go to the restaurant. Going out and eating out is a part of our lifestyle, and it is growing today. And it is unfair to have a cancer patient who feels all right to be able to go out, to not let them go out. So what are the things that you recommend for them if they were to go eat out at a public place or in a restaurant?
So that's absolutely right. And even with our patients, when they want to go out, we encourage it. Of course, as long as it's well within the limits and not doing it every single day. But we have patients who message us and kind of send us pictures of the menu and say, what should we pick? I would always recommend, when you're going out, obviously, stick to the fresh foods. So always go to, and this is not only for patients, I actually do this myself, where, if you go to a restaurant, request them to make something for you, change the dish a bit, because then that they are going to kind of make it as fresh as possible. So if you're having, grilled chicken with vegetables and, say a salad or something like that, and that might not be in the menu, but there might be some version of it, then tell them that this is how I would like it done. So always tweak the dish a little bit, and this is for all of us, to ensure that there's some kind of freshness to the food. While salads sound wonderful, it's something that you need to kind of stay away from, especially the dressings, because they're really rancid with the ones that they're using in restaurants. So you have to be mindful that, okay, if you're having a salad, then you make your own dressing. So I want some lemon, maybe a little bit of honey and balsamic vinegar on the side, and I'll add my dressing, So that's how you tweak it a little bit. Again, I would recommend not going for the protein if you're unsure of the quality of protein. This would be extra for the patient. Stick to vegetarian, stick to vegetables. Even like a vegetable medley or something where you can ensure that there are going to be more vegetables on the plate. But tweak it a little bit. It really helps if you tweak it a bit.
And Samara, in one of your earlier answers, you were talking about choosing grains which are available in the region. But India also has different parts of the region, different seasons that we experience. In some places, it is very harsh seasons, extremes, and the other places are very moderate temperatures. So how important is choosing seasonal food and regionally available foods for someone who is facing a condition like cancer?
Very important, because again, you want to ensure that you're going for something that's reasonably fresh, right? So you don't really want to go for the imported fruits. You don't want to go with any vegetable or fruit where you know that they have, it has full of preservatives because they just want to kind of elongate the shelf life. So if that's why we say if you can do organic, that's wonderful. I understand sometimes it's difficult for people or it might be a little more expensive. But if you have the capability of spending a little extra, then you want to do that for yourself, especially when you're going through treatment. But then you will ensure that there are regional and seasonal fruits and vegetables that you're consuming. So they're fresh to some degree. Go to a farmer's market, get your vegetables for the week from there. So making that extra effort goes a long way. But what we ensure is that also the cleanliness of the fruit and vegetables. So when you come back, ensuring that there is significant amount of hygiene and that it's washed thoroughly or soaked in a bit of warm water and baking soda and a little bit of vinegar, and then washed after that. So all of that are precautions that we have to take when we are on treatment. But definitely sticking to regional and seasonal fruits and vegetables is really your guide. You don't have to worry beyond that. If you just kind of stick to them, that's really going to be your guide in consuming better food for yourself.
And Samara, before I let you go, my last question to you is, what is the contribution that you wish to make through this book on the lives of cancer patients and survivors?
So when it comes to patients, I want them to celebrate food and understand that nutrition can be delicious, it can be easy to make, and it can have a huge impact on your overall well-being while you're going through treatment and post-treatment. I want patients to understand that while cancer is definitely a challenging time, it's not the end of the road. We see this every single day. And just tweaking your nutrition can have a huge impact on your overall well-being. I also want, and I want to dedicate this to caregivers as well, me being one myself. I see, and we work with thousands of caregivers who are so emotionally and physically distressed. They don't know what to make for their patient at home. They don't know how to actually put that food together, and they're completely lost. And we want this book really to be a guide for them, so it makes their life a little easier when they are caring for that loved one going through cancer.
Awesome, Samara. I think this is a brilliant initiative because, in this world of personalization, while there are books on recipes available for people who are dealing with diabetes, etc., but I don't think there was much available for cancer patients dissected the way you have done it. And some of the things that come into my mind is that how beautifully you are talking about, something that is easy to prepare and yet enjoyable to consume by the patients. And, the pains that you have taken to ensure that these are based on the scientific evidence, experience of what you have seen with the patients, and also, validated by somebody who's clinically trained to say that, yes, this is something which is correct. I also, want to bring out one or two points that you brought out in your conversation, which are really, really important to emphasize. That one is, when we are looking at preparing food for somebody who's dealing with any condition, it needs to be personalized. Because, like you said, it has to ensure that it is not counteractive to anything that affects other comorbidities that the person may be having. And second is, the takeaway that was there was the tip that you shared, that when you go to a restaurant, try to ask them to tweak the recipe a little bit so that you are at least assured that whatever is being served to you has been prepared fresh. These are pearls of wisdom. Thank you so much, Samara, for taking out time to speak with us and sharing your insights and about your book.
Thank you, Harvinder. It's always a pleasure to speak with you. Thank you very much.